Hello. I've been wanting to make this video for a while now, but I haven't, so I'm making it now. I wanted to recount an experience I had recently where I was diagnosed with a cervical ectopic pregnancy and ended up in the hospital for a little while. And when I was in the hospital, I wanted to research what was going on with me, but because that diagnosis is so rare, most of the information online is very clinical and most of it is in journals. And I really just wanted like a bubbly, pleasant sounding woman on YouTube to tell me that it was all going to be okay. So I thought I would try and do that for someone else on the off chance that you're also dealing with this somewhere in the world. So I thought I'll just catalog my experiences throughout that ordeal. There's a lot to cover, and there's a few things that apply to like not just having had a diagnosis of an ectopic, but also I had a uterine embolization, which is like you get also if you have fibroids. So I thought I'll like break everything down, and I'll put in the description like if you're interested in hearing about what happens when you get a uterine artery embolization, go to this point. If you want to know about methotrexate, go to this point, and whatever. So first of all, it was all great. No, it wasn't great, but I'm fine. It was all fine. It all worked out fine. That was my main sort of anxiety in the hospital, was that it wasn't going to be that fine. And the thing is, because it's like a super rare diagnosis and a super rare complication of a pregnancy, I can't assure you that our experiences will parallel each other's that exactly, but I'm sure there's a lot of similarities. So basically I presented with severe bleeding. That's like how I ended up in the hospital the first time. When I got there, they kept asking me how many pads I was soaking through an hour in order to like get a sense of how much I was bleeding. And I kept telling them, I'm soaking through so much that like that question's absurd. Like I'm soaking through a pair of sweatpants an hour, if that better explains how much I'm bleeding. And it took a really long time for them to register that. I don't know. It's like it is such a rarity that I think they were either thinking it's a miscarriage and she's overplaying how much she's bleeding, or she has her period and she's never had it before. She's 14. I'm 27. So I went to the hospital. I waited for they checked my blood to see if I was pregnant. I was pregnant. I was about 5 weeks pregnant, and then I waited another 6 or 7 hours or so before I got a transvaginal ultrasound to see what was going on with the fetus. And then in the morning, so I'd gone to the hospital in the evening, and in the morning they told me that it was this cervical ectopic, and they took me over to a different hospital where they could better deal with that diagnosis. So ectopics are not that uncommon. I mean, they're pretty uncommon. Cervical ectopics are more uncommon. So if you're watching this and you have an ectopic, maybe you have a fallopian ectopic. I don't know anything about abdominal ectopics. Those are like, those are even crazier. But if you're watching this and you have an abdominal, sorry, your thing's too crazy. But yeah, so cervical is pretty rare. And a lot of the more senior gynecological staff at the hospital I was transferred over to had never seen one. And like there's not a lot of statistics on it. So it's very frightening because you don't really know what the outcome will be, because I mean you never know when you're sick, but there wasn't enough data to let me know what to expect. So they took me to this hospital, and they once I was there I was told I would need two things. The first is a uterine artery embolization, and the second is was going to be multi-dose methotrexate. So methotrexate's a chemotherapy, and the idea is chemotherapy just shrinks the fastest growing cells in your body. So in my case, or when you're pregnant, that's like the fetus that's growing in your body. So okay, this would be a point where I put like a marker of some kind in the time. I'm going to talk about the uterine artery embolization because this is the thing I mean, I wouldn't have had time to watch a YouTube video before the procedure, but I do wish that the doctors had better prepared me for what to expect. And if you are going to get one of these procedures, chances are if you have the ability to watch a video beforehand, you're probably getting it for like something closer to fibroids than because you're bleeding profusely, acutely in the hospital. But they told me that I could expect to feel like really bad period cramps. And that's not untrue in the sense that they feel like period cramps, sort of, and they're really bad. But I later looked up, I just wanted to see if maybe my pain threshold is really bad, which I didn't think it was because I've had a few other painful procedures in my life. But I looked up pain associated with embolization, and women who have, like on the threads, women who have had children say that the pain of an embolization is much more akin to labor than it is to bad period cramps, which is fine, right? Like, who cares? We'll deal with it. It's fine. You'll deal with it. But it's nice to know that. And then it's nice also to be able to advocate for yourself beforehand that you really need your pain managed properly. The radiologist who did the procedure was super nice. He was a dude. I don't know. Maybe he thinks that's what period cramps feel like. I couldn't tell, him. How would he know? So he told me that's what it would feel like. That was completely underselling how bad the pain was going to be. I'm like a pretty stoic person. I don't tend to be an alarmist, but like, it was really bad. It was really bad. It peaked. They say that it'll peak at 2 hours and sort of plateau and get a bit better after the 2 hours. But like, it was just hellishly uncomfortable for 6 hours. And I don't think my pain was properly managed, and I think that was the problem. Like, they gave me a lot of opiates and they didn't touch me. Like, they did not touch me. They gave me fucking fentanyl and hydromorphone, like, cocktail of opiates. And it wasn't until they gave me a very powerful NSAID, like a very powerful anti-inflammatory, that I finally had some relief. I just don't think they got on top of, like with opiates, you have to get on top of the pain before it gets really bad, or they're kind of futile. So I don't think they got on top of the pain in the right way beforehand. So I don't know if you have the ability to advocate for yourself before this procedure. You should try and do so. Show them this video as like evidence that it really hurts. So that was bad. And you also can't move. Oh, this is another thing to expect. You can't move on your sides after. You have to lie on your back. So that's kind of frustrating because you want to be able to writhe in pain on your sides, but you can't. So you can just, scream at your mom or bite a pillow or whatever you got to do. And then it's fine. Like 6 hours later, it really did drop. The pain dropped dramatically. It's like, okay, and you feel like it's never going to end, and then it ends, like acid or turbulence. So after that, I was finally like, my pain was alleviated somewhat. Those opiates started to actually work because I, wasn't fighting them so badly with my discomfort, and I fell asleep. And then they woke me up and they were like, okay, we need to start the methotrexate, the chemotherapy. And they told me a few things to expect. So the dose the dose of methotrexate that I needed, or you or one would need for a cervical ectopic, is much lower than you would need for most cancer treatments, but higher than you need for other kinds of ectopics. So it was another one of those things where they weren't exactly sure like what symptoms or side effects I could expect. I mean, that's not fair. They definitely knew, like they had an idea, but they can't promise you anything. I kept kind of expecting promises, and of course they can't make any promises. So they said I could expect some nausea, maybe to puke a little bit. They said I could expect probably some hair loss, but probably not a lot. I'll tell you now, this is just what my hair has always looked like. So I didn't really experience that much hair loss. And then they said mouth sores, and that's the one that I felt that actually I did experience the most severely. I puked a few times. Like, it's hard to say if my nausea and the puking was a combination of because I was on opiates for my stay in the hospital, was a combination of the opiates and the methotrexate, or one or the other, or just severe stress. But the mouth sores, yeah. So I experienced those, and they were like sort of uncomfortable. Again, a lot of discomfort I experienced throughout all this was sort of just like dampened by how little blood I had. So I was sort of like not able to focus on a lot of my confusion. I mean, a lot of my discomfort and pain because I was confused and tired. Mouth sores, yeah. What was the stuff I got called? I'll look it up. Biotin. There we go. Yeah, I got biotin and I gargled with that, and like, I don't know if it helped. It might have sped up the recovery. Like, I was on chemo for 11 days, so I don't know. So I just kept getting mouth sores, and then I would take the biotin, and maybe it was like dampening the discomfort a little bit. I don't know. But why not try? So that was the main side effect I had. So basically what they would do, and like, I'm sure if you are in the exact same position as I was and you're getting multi-dose methotrexate for a cervical ectopic pregnancy, that what they're doing is giving you a dose of methotrexate one day, and then waiting 2 days to take your beta levels to see if they've dropped the way they'd expect them to drop, or the way they're hoping they would drop, to see that the methotrexate's actually working, and that's by 15%. And then they'll take your blood 2 days after the last dose, and if they haven't dropped the way they were hoping, they'll give you another dose, and then they'll keep repeating that cycle until the betas drop by 15%, and then they'll let you go. So that's what I did. I was there getting methotrexate every other day for 11 days, so I got 6 doses. And after the 6th dose, they checked my blood, and my beta levels had dropped by 14.4%. And my sweet angel doctor, who just was like the most unwaveringly tactful, sweet angel the entire time, said like, that's good enough for her. She'll let me go. She'll assume that I'm on the mend. So I got released from the hospital that day, which was great. And then they basically said for a month you can't swim, have sex, or take a bath. So you can't like stew in any kind of liquid for a month. So, which I obviously abided by. And then they said no, heavy lifting, no going up and down stairs too much, no working out. So, I mean, I did all those things to the best of my ability, but like, I had to go up and down stairs just by nature of living my life a little bit. I didn't put myself on strict bed rest because they didn't put me on strict bed rest, and I was still out doing stuff I had to do for my job or my life. But I never stood for any length of time, and I didn't like climb stairs for sport or anything. One way or another, I don't think it's anything I did. I happened to have a very vascular pregnancy in my cervix, so it was a lot of my blood vessels were attached to the fetus. A lot of them were attached to the fetus. So when things started to bleed in there, they really started to bleed. So 4 days after I was let out of the hospital, Jesus, this is a long video. 4 days after I was let out of the hospital, I started to bleed again, and they basically said if you're soaking through more than 1 pad per hour, you have to come back. And I was definitely doing that, so I went back. And this time I got seen a little more quickly just because I had like a hospital card, and they knew my story, and they know that this is a vascular pregnancy, and I tend to bleed out pretty quickly, although they still didn't. I don't want to complain about that. Our healthcare system is great. It just means you don't get seen this quickly sometimes. So I ended up needing another transfusion, and then I was administered to the hospital. This time I had a beautiful private room, just by nature of when I got admitted to the hospital. It wasn't very busy, or there weren't, I guess, as many people in the hospital. So that was sweet. And then they basically said we need to. Okay, so this will be another marker in the video where I put a time and tell you what I'm going to talk about. So they basically said we're gonna do a DNC, which is a dilation and curation. Is that what it's called? Here we go. DNC. Democratic National Committee. No. Dilation and curettage. Did I say curation? I'll leave it in. I don't know. I don't know what I'm talking about. Okay, dilation and curettage. So they scoop out the baby, essentially. But those aren't frequently performed on cervixes or in cervixes. So the whole thing was like so the word hysterectomy had been floated around a few times throughout this whole thing. And depending on which doctor I was talking to, I had a lot of doctors on the case. So depending on which doctor I was talking to and like at what point I was at in this whole procedure, so depending on like where my betas were at and how well I was responding to the methotrexate and how high my hemoglobin was, like different doctors would give me different answers about how likely it is that I would need a hysterectomy. I can't tell that I'm 27. I'm 27, so I didn't want a hysterectomy, and they really didn't want to get me a hysterectomy. So basically, with this DNC, the whole thing was, they're going to go in, and it's really unlikely that it will lead to a hysterectomy. But if it bleeds too much, and like they would have put in like a tamponade, like the balloon to stop the bleeding, and that doesn't keep it under control, they will have to perform a hysterectomy. They didn't have any statistics on how likely that was, though, because like they don't do that procedure in that area of the body like very frequently. So they were very comforting about it, but it was still like unclear how likely it was, and it's just a scary fucking word. So they said but the other thing was they didn't want to release me from the hospital and sort of telling inside of order here. So essentially, second time I was admitted to the hospital, they said, we're going to need to do a DNC, but they didn't want to have to do the DNC that evening. It was a Friday night. They wanted to wait till the Monday because it's better to do it when it was a relatively serious procedure. Serious is the wrong word, but they wanted more people in the hospital for it. I'm imagining like people for if there's like a blood loss issue or if they did need to do the hysterectomy, like they don't want people on call on golf trips. There's more people in a hospital during the week. So that's what they wanted to wait for. So in order to sort of defer the surgery, they gave me this blood clotting medication that's it initially slowed and then stopped my bleeding. So that was really comfortable and great because I was so scared I'd have to get another embolization. I really didn't want one. But bleeding like that is so uncomfortable. Bleeding that profusely is so uncomfortable and creepy. So they gave me this blood clotting medication. It was amazing. They were like, oh, you might experience a headache or a severe headache. I was like, that sounds amazing. So I did get a headache, and it was just the best. It's great. And it worked super well. So they were able to push the surgery to the weekday. And this was sort of the most emotional part of the whole experience, just because things were sort of in my hands. Like I got to decide if I went ahead with this DNC or left the hospital. And they didn't want me to leave they basically said, we don't have the right answer, but ideally you don't leave the hospital with this thing still going on because Jesus, 20 minutes. Okay. Your hemoglobin is already so low and you've already needed 2 transfusions. And this is sort of like an untenable cycle. You can't keep coming in here with blood loss. We'll give you a blood transfusion. You leave. It's just, that's crazy. And it can get quite dangerous. The more times that's done, the lower your hemoglobin will get, and you need hemoglobin. So they said in there they can't they can't make the decision for me, but they think that I should get the DNC, and the hysterectomy is unlikely, and Okay, so I made a big pros and cons list, and I decided I should get the DNC. So Monday came around, and I was on the OR list, and I was technically in emergency surgery, but like not number one or even number two. So I didn't get it on the Monday. And then they were thinking it would probably be the Wednesday, or the Tuesday or Wednesday. But basically, I asked them if they could please do a blood test and an ultrasound before the procedure, just on the off chance that things were resolving on their own, and I wouldn't need the DNC, and that if I left the hospital, it actually wouldn't be so dangerous. So, I mean, they were always going to do a blood test before, but I don't think they were going to do the ultrasound before the surgery. But I requested it, and my doctor, sweet angel, said, sure, let's do a transvaginal ultrasound, see how that bad boy's hanging on. So we did the transvaginal, and it turned out that the pregnancy was much less vascular at this point. And we did the blood test, and it turned out that my beta levels, my pregnancy levels, were dropping even more dramatically than they had already been dropping, which was great news. So they said, they took me off the blood clotting medication, and I still wasn't bleeding, which means I wasn't bleeding on my own. It wasn't the blood clotting medication. So they said, it looks like you can go. Like, it looks like you're good. You're not finished, but it looks like you probably won't bleed out again. And this thing's like really on the mend. So they released me from the hospital for a second time. And they basically said to me, they said, this thing's either going to pass or absorb. And if it passes, it'll be quite obvious because it will come out of your body and there will be tissue. And if it absorbs, it won't be as obvious. Perhaps it'll absorb the strength of the baby and all its powers. But, obviously it's more obvious if it passes. The other thing they said is if it absorbs, then a little while, if and when it absorbs and if and when it passes, a little while after that, you can expect what was described as a very weird period. And I said, do you mean like in length or consistency, or like, is it going to be heavier? And she just said yes. Like, just yes, everything. It's going to be weird. So I left the hospital, and 4 or 5 days after I left the second time, I started bleeding again, heavily, like very heavily, but not nearly what happened the first 2 times. And I was like, all right, I'm not going, the ER is so stressful. I'm not bleeding enough that it's dangerous. This is one of two things. It's probably either it's either the fetus passing, like the tissue passing rather, or this weird period they were talking about. Like either the tissue's passing or the fetus actually absorbed a little while ago, and yeah, this is the period. If it was the period, it was certainly weird. If it was the fetus passing, it was about as normal as you'd expect a fetus passing to be. So it's hard to say which one it was. And then subsequently, I would go every week for a blood test to make sure my beta levels were dropping, and then I got to stop when they reached 0. I didn't get a 0. I got a 2, which is like nothing. Like, for context, my beta levels were I think like 8,000 when I got administered to the hospital. So 2 is as good as 0, but I wanted a 0 just for it to be 0, just for like rigidity and the purpose of getting to say that it was 0. But yeah, so I finally got my 2, and they said, you're good. You don't have to keep getting blood tests. The baby's as good as done. And yeah, that was the whole experience. So I kept my fertility as far as I know. Like, I know with embolizations, they're quite, I don't know, who knows, right? But I mean, they told me they're quite safe in terms of fertility, but that if you get 2 in a short period of time, short being like a few weeks, there's a 2% risk that like your ovaries shut down. And there was it was looking like I might need to, although the blood clotting medication worked. So anyways, everything turned out as best as it could have. And my ovaries were fine. I did not need a hysterectomy. Although, if I had needed one, like, though they do them laparoscopically these days. And look, it's very upsetting. I understand for your fertility. Like, it was something I wanted to avoid. But God forbid if that's where you're at in your journey, like, it'll be okay. There are so many ways of having children these days. And it's just like, you got to do what you got to do for your health. It's sort of what I came to at a certain point in this whole thing. Like, my fertility is important to me. My freedom is important to me. But your livelihood is everything. So you got to do what you got to do to get better. And then you go from there. So, yeah. So, I mean, it worked out pretty well for me. And statistically, it does work out quite well for a lot of women with cervical ectopics these days. They used to like use less conservative methods of treating it, but now with the multi-dose methotrexate, that's generally like the course they take if it's possible, and it tends to preserve fertility quite well. So presumably, hopefully that's what you're getting. And with the methotrexate, like, yeah, nothing, it wasn't too bad. It's pretty low dose, just like a little uncomfortable, but God, nothing compared to how bad it could have been. And yeah, the embolization fucking sucked, but it was 6 hours and then it was fine. Def have PTSD, but I'll go to therapy, you know. Yeah, so if you're getting an embolization, again, like, just make sure you explain to them that you've heard it's quite painful and please manage my pain properly. All right, I'm rambling now, so that's it. That was my journey to the center of the universe, center of my cervix. So if you have questions, ask a doctor. Don't ask me. I told you everything I know. But if you want to just like chat, I would totally chat. This was very emotionally trying for me, and everyone in my life was very kind about it, but I really wanted to talk to someone who had been through it. So if you want to talk to me, you can send me an email. My email is Laura, Laura, Leibow, Leibow @gmail.com. I'm not going to put this on my YouTube channel because everyone in my life is so fucking sick of hearing the details of this story. So I'll make a new channel and I'll just make sure I tag everything in it like that I think is relevant. Uterine embolization, cervical ectopic, methotrexate, hysterectomy, whatever. So you can find it if this is something you're looking for. Because this was something I was looking for a while. Also, I was in the hospital for like 15 days total, and you get fucking bored. And I read all the journals, but you want to see some moving pictures and someone like telling you what to expect and telling you that it's okay. Because it's fine. It is. It's going to be totally fine. Okay. That's it for me. Good luck with everything. And if you're watching this, not because you are needing the relevant medical information, but you're just weird, it's up to you too. You know, I hope it's all going great. I'll talk to you guys after my next medical emergency. Bye.